Hello everyone, we're so glad you're joining us for this video. Today I am chatting with Nanki Robbertse. She is an occupational therapist and she's also a special needs mom. And she is going to give us a bit more information about her practice, the way she does therapy, and also about Tomatis therapy, which is very interesting. And I think we're going to learn a lot. Welcome, Nanki.
Thank you, Annie. Thank you for having me.
It's a pleasure. Nanki, I want to ask you, your occupational therapy practice, what exactly do you focus on if it comes to therapy?
I focus on children from the age of 3 to 10 that is struggling with mostly sensory processing disorders, but also children with developmental concerns, children that do not, that maybe struggle with some skills at school. Normally it's the school teacher that refer them for occupational therapy. If the child is younger, the parent sometimes comes to me with some concerns at home. So it must be a child that is struggling with something functional at school or at home. But I like to focus on sensory processing because that is one of my fortes, and I love sensory processing.
And I would think that your approach changed a bit since you had special needs children of your own, right? That things, you had to go into a more specialized area, or you were exposed to more specialized spectrum therapy. Is that what happened to your practice?
I think it's busy happening. I don't think I'm already there, but I feel more confident treating also children on the spectrum because I feel I know personally how it feels like to be a mom. So I have a lot more empathy, and I think I understand the struggles, and I think I understand if homework isn't always done. And I think I understand that parents need a lot more emotional support. And that's just as important as doing the therapy with a child. So although I haven't been seeing a lot of children on the spectrum, I feel more confident, and I feel actually I can say I can specialize now more on children on the spectrum.
Well, if I look at your Facebook postings and all the things that you set up in your backyard, I'm sure that you can do that. Listen, Nanki, can you tell us a bit more about the Tomatis therapy that you also give to children?
Tomatis therapy is an additional tool in the toolbox that a therapist can use. And it is basically a listening therapy. It is listening therapy to enhance the skill of listening. But the skill of listening is just not hearing. It is hearing and processing what you hear and being emotionally okay with what you hear. And that is a very important aspect with children that has sensory difficulties, but also with children on the spectrum. So sometimes what you hear is too overwhelming and your central nervous system cannot cope with it. So Tomatis therapy not only helps you to listen better, but to deal with what you hear also better. This therapy was developed by a French ear, nose and throat specialist. And his mom was an opera singer, but he also worked for the Air Force in France. So he addressed a lot of people that had difficulty with hearing due to noise, but also opera singers, how to enhance their musical skills by improving their listening. So he said you cannot produce with your mouth what the ear cannot hear. So he developed this therapy. And there's a lot of other listening therapies, but what makes Tomatis different is they use contrast. So you listen to classical music, mostly Mozart, but the program uses two programs. You have a program 1 and a program 2, and there's a difference between the intensity and the timbre of program 1 and program 2, and it shifts the whole time between program 1 and program 2. So your ear has to adapt the whole time, because there's change, and the change is unpredictable. So that requires attention. So your brain needs to attend because it doesn't know what's going to happen next. So yeah, that's the only listening therapy that uses that contrast. There is other listening programs as well, but it's also very well researched. It has been used a long time. Tomatis, Alfred Tomatis has already passed away, and his therapy has advanced as the time went on. Yes.
Now, can you tell me, how did you find this therapy? Because I'm sure there was lots of things that you've done before, but then this therapy is really something that you are now very excited about. How did it come across your path?
As an occupational therapist, I heard about listening therapy, and I've always been interested in doing it. I just didn't have the time and the resources and to do it. But since my child has been diagnosed being on the spectrum, I've been doing a lot more research on what can help him. And then this year I did the research and which listening therapy is the best. So I came across Tomatis, and there's an occupational therapist in the States, in America. She is a South African, but she has been working there for a few years. And she is a Tomatis guru, and she does the training. So I did also a Zoom consultation with her. And after speaking to her, I was hooked. I just knew this Tomatis therapy is going to be amazing, and I couldn't wait to learn and start using it in my practice. But any type of therapist can do it. It's not only OTs. Speech therapists can do it as well, and psychologists can do it. And I think there's music therapists that do it, but you have to do the training first.
I always get excited when I know that, you're a parent, because there's another kind of commitment to something that will actually work, right? It's not just therapy for therapy's sake, but therapy to get some results. And I think that's something that the people that might reach out to you can have some confidence in, is the fact that you want to try something that will actually work and give some momentum to a child's development and what we want them to learn. So that's very exciting. Yeah, so you say that if it comes to children on the spectrum, you because this is so sensory focused, right? Sensory focused. Is there anything specifically that that you'd like to say about spectrum children and this therapy? Something that
Yes.
that you feel it'll definitely make a noticeable difference on them.
Yes, Tomatis therapy is known to help children on the spectrum. So that is one of the things that they say. It can actually help children that has sensory difficulties also, that is not on the spectrum. But because children on the spectrum has so many sensory difficulties, normally they do have a lot of sensory sensitivities. Tomatis will help them. But also auditory sensitivity is also usually a problem with children on the spectrum. But I think also the multisensory effect. I think a child on the spectrum gets so quickly overwhelmed by multisensory stimulation at the end of a day or after an event. And Tomatis really helps the whole neurological system just to process sensory information better. It also helps with auditory sensitivity. It also helps with speech, language development, auditory processing, and some of the children on the spectrum also struggles with speech and language. So both the listening and the speech can be improved by Tomatis. Another thing that Tomatis can also help is it also helps with emotional dysregulation. So a lot of children with sensory processing difficulties, including children on the spectrum, does also struggle with emotional regulation. So this Tomatis therapy also helps with that. And I've also heard therapists and the therapist who trained me that it helps with sleep as well. Some children sleep better. But what I have to say is you cannot say in advance what is going to change or how the child is going to change, because each child, their own neurological system is different. So all I can say is it will improve and it will make a difference. I cannot say beforehand to what extent or how much. There is some cases where children on the spectrum did start speaking after doing Tomatis, but I would never say that to parents because we wouldn't know. And normally what Tomatis does, it just opens a gate. Sometimes all the therapies that has been done has had an effect, and Tomatis is just a thing that makes that switch in the brain. So it's not always just the Tomatis. Tomatis also makes other therapies work better. So if your child does occupational therapy or speech therapy, doing the Tomatis alongside it will make the therapy more effective because it makes your brain more receptive for that input.
That sounds very good. And I know as well, I think that the big thing about children on the spectrum is the sensory shutdown, right? So if we can fix that in any way, so many other things can fall into place. Thank you so much, Nanki, for your time today. It was wonderful to speak to you. And we're going to put all your information just here in the post or on the video text so everyone can find you. And if they want more information, please contact Nanki and she'll be able to help you to book a...
Thank you, Ioane. Thank you for the time and the opportunity.
It's a big pleasure. Bye-bye.
Bye.